start. Perfect. Okay, welcome. As you're signing in, we've got 4 or 5 minutes before we get started. So we'll keep our chatter to a minimum. That's great. I know, I just realized if we'd done this as a meeting, we could see faces, right? We should have done it that way. Yeah, this is when we could have had the music on hold, Ben. I didn't think of that.
Oh, yeah, we can put that into Zoom, can't we? Right,
Yeah,
Ben, didn't you say that we can do a background music?
He did, only if it's a meeting. And so I think I'm gonna have to figure the math out on that one. So yeah, I don't quite get what the difference is. So we'll see how that goes.
I'm just gonna share my screen once just to make sure it works.
Good idea.
Okay, you can see it.
We
Yeah,
can
that's good.
Look okay?
Mhm.
It does. That's beautiful. We have 9 already in, so that's good. We'll give them a few minutes. We have 59 registered for this.
It's a good number.
I'm looking forward to this.
Yeah. Hi, Annette.
Oh, there you go. We can hear you. Okay, good. Yay. Thank you, Karen. We're happy to have you. It's good. I like these little chats. If you want to throw into the chat where you are right now, what town you're in. So I'm going to say, oh, Karen wants to be a mentor as well. This is awesome. Okay. Kita, oh, Hamilton, another Hamilton. Bowmanville, Guelph, Toronto, Chatham. Ottawa, Markham, we're all over. Okay, we'll just give it another minute or two, and then we're going to get going. When you post in the chat, note who you're posting it to as well. Make sure you're doing your post to everyone. Because of course that's what I did incorrectly the first time. Happy early holidays. It's going fast, isn't it? Yeah. Okay, are all of our panelists ready to go?
Yeah, I think so.
Okay, we're going to get started then. So, welcome to our monthly We Learn webinar. So this month we're talking about a new venture for WeRPN, and we're proud to be focusing on the WeRPN Research Strategy. I'm Sharon Foster, and I'll be your moderator for this evening. I'm an RPN in professional practice and education, and I'll be facilitating our talk this evening. I invite you all to now ensure that your mics are muted, and if you could enter your questions into the chat as you think of them. Our panelists will do their best to respond individually. You may also save them for the question period at the end. So presenting this evening is Dr. Nancy Snobelen. Nancy is engaged by WeRPN as a research consultant and is really enjoying the experience of enhancing the presence of RPNs in research literature. She's a strong advocate for RPNs, having invited Diane Martin into the workplace to shadow Stacy, an RPN, several years ago now. Dr. Snobelen has served in formal administrative roles in the Ontario health system for many years in the area of rehabilitation, quality improvement, and system integration. Her dissertation was focused on developing a competency framework for the RPN's role in inpatient rehabilitation. Nancy will discuss the origins of the WeRPN Research Strategy, the current status of implementing the research strategic plan, and where the WeRPN members and all RPNs fit into our next steps. Nancy's a registered non-practicing speech language pathologist. She has a master's of business administration degree from the University of Windsor and a doctor of health administration degree from Central Michigan University, Mount Pleasant, Michigan. Our second presenter is Benjamin Hartung, a registered nurse who has been supporting WeRPN with their research mandate. Ben has been a strong advocate for RPN representation in nursing research and for RPNs participating in leading nursing research. He will provide an overview of the new upcoming e-learning course, Demystifying Research, an introductory course on nursing research. A little about Ben. He has worked in a variety of clinical settings, including med-surg, long-term care, supportive living, community care, and cardiovascular ICU. He has an MSCN from the University of Toronto, a BSCN from Lakehead University, and has authored several peer-reviewed nursing articles and conference presentations. As our final presenter, I welcome Jen Calver, who some of you may already know. Jen is a longstanding WeRPN member and sits on our Social Sciences and Humanities Research Council of Canada research team as a co-applicant for the current study titled COVID-19 and Resiliency, How Registered Practical Nurses Working in Long-Term Care Adapt in Times of Personal, Professional, and Institutional Crisis. Jen has a background in clinical practice, leadership, teaching, and research roles across healthcare and academic institutions. She has a special interest in health service research, aging, nursing, and policy. Jen is completing her Master's of Health Sciences from Ontario Tech University and remains actively involved in nursing and research communities. As an RPN, Jen will be sharing her story and experience on how she advanced her professional development with research and what lessons she has learned along the way. Okay, slide number 2. The objectives of the webinar are on the slide in front of you. There we go. Tonight, we hope you take away an awareness of the WeRPN Research Strategy and why it's important to you, an up-to-date understanding of the current status of all the activities that have taken place since the development of the WeRPN Research Strategic Plan 2021 to 2024, and the next steps of implementation. We hope you take away knowledge and excitement about the joining the upcoming research professional development e-learning course titled Demystifying Research, an introductory course on nursing research developed by Ben Hartung, and the experience of a firsthand story of how Jen Calver, a WeRPN member, has incorporated research into the reality of her professional life. So let's get started. Why has WeRPN engaged in developing a research strategy? So in 2017, WeRPN conducted a province-wide innovation fund supported innovating to optimize the RPN tour that focused on clarifying the RPN role, promotion and advocacy, professional development, and innovation through leadership and delivery of care. From our engagement, we heard that RPNs wanted to continue to have professional development opportunities to better serve their clients, better deal with situations at work, and have better opportunities for formal and informal leadership roles. The goal of these presentations, focus groups, think tanks, and surveys was to engage RPNs to understand more about research, participate in research, and use research to influence practice, client outcomes, and government and industry decision-making. As a strategic driver in the WeRPN strategic plan, we want to see more robust body of evidence about the role of RPNs. We want to also increase the representation of evidence in the literature regarding the utilization of RPNs, the optimization of the RPN role, and the impact and value of RPN interventions on client outcomes across all sectors in our health system. We want to influence the broader research and nursing community, and we want to lead the development of this research to encourage better representation of RPNs and how the system and patient outcomes are impacted. As we create a research strategy, we wanted to be mindful that the research activities wove together with the values of WeRPN and to directly address the strategic driver of driving evidence and support the other strategic drivers, advancing expertise, innovative growth, advocacy, and influence. And now, I'd like to pass the presentation over to Dr. Nancy Snobelen.
Thanks, Sharon, for that introduction to what we're speaking about this evening. Hi, everyone. I'm going to start right into the next part of the presentation, which is to describe the development of our research strategic plan. So the goals of the research strategic plan were to create a vision and guidance document for the WeRPN executive leadership team to achieve that strategic driving evidence. It is a plan of approaches on how to develop evidence that can be used for improving clinical practice, health system processes, and government decision making. Many times our executive leaders are asked for data to support initiatives for RPNs, and although there is some evidence in the literature and considerable anecdotal evidence from your members' lived experiences, formal research data and literature isn't available and is required to influence policy, decision makers, government, and industry leaders. So we have a strategic plan now, but it requires implementation. So let me ask you a question. And can you answer the poll question in front of you? So I think you're going to have to do that, Sharon, if you can do it. So would you say you are creative, curious, and inquisitive? And Sharon, can you put the results up? Wow, that's great. 12 of you. So 100% of you suggest that you are either already RPN researchers or have the personal characteristics and traits to become a researcher. You've probably asked yourself many times, how could I do something, what I'm doing better? How could this task be done better? And are there ways to get better outcomes for my patients, my clients, and my residents? You probably ask yourself, do I use recent, current, relevant evidence in my daily practice? And how would I know that? It's easy to find. Is it easy to find, easy to access, and easy to apply? These are questions a researcher would think about. And from an employer perspective, does your organization partner, initiate, or conduct research activities to create current, relevant evidence for your daily practice? Have you personally been involved in any research within your organization? Again, these are all questions you probably ask yourself when you're trying to engage in the WeRPN Research Strategic Plan. As a component of the entry to practice competencies, RPNs are required to use evidence-informed practice. So there are two main strategies in this plan to help achieve that. First, to create an inquisitive research knowledge culture within the RPN membership driven by the WeRPN professional practice team. It's essential to facilitate interest and desire to identify and use evidence that informs practice. In other words, you're going to try and build capacity to feel comfortable using evidence more frequently. And then the second strategy is to sponsor, support, co-produce, or create priority area research projects that reflect current population needs and trends, but it emphasizes RPN-specific cognitive knowledge, skills, interventions, and tactics aligned with WeRPN research priorities. For these two strategies, there were four research key priorities. The first one, RPNs are gems. Studies in this priority area should focus on the value and impact of the RPN roles. Studies should demonstrate the economic value of the RPN role. The second key priority is RPN's care. Studies that investigate improvements in the delivery of care, such as different models of care, different leadership models, expanded opportunities for the enhanced scope of practice, ensuring quality of care is maintained. The third priority is about RPNs are agents and leaders of change. These priorities are studies that investigate excellence in clinical practice and leadership for better patient care outcomes. And then fourth key priority is that RPNs are crucial links in the workforce chain. Studies that investigate health human resources and workforce planning are crucial to address workforce needs now and in the future. For example, studies that address the training spots required for the future, the impact of career laddering programs like the new Begin program, or leadership educational programs and the evaluation of such programs. So those are the four key priority areas that the research strategic plan focuses on. So going back to the first strategy, creating an inquisitive research knowledge culture, RPNs are required to use evidence-based practice, but they have sparse opportunity in their educational curriculum to fully engage in research. And searching for the best evidence needs to be practiced in order to gain confidence and the use and use the most recent evidence. So the first action is to create this culture of research within the membership by developing an increased capacity for understanding, using, and creating formal evidence. We will know we've made a difference in the culture when RPNs start to report increased confidence with finding, evaluating, and using literature. When there's increased numbers of RPNs participating in research studies, and even some evidence that RPN-led research projects have begun. And we're doing that through these 5 actions at the present time. The first action was we developed a call for RPN research fellowships. This component was designed to embed an employed RPN into research. The RPN was to bring a research or a quality improvement idea and collaborate with an academic researcher to develop and carry out a research project. The concept was to assist the RPN to understand and learn the components of a research study with the goal of increasing the enthusiasm and excitement of creating more RPN-specific frontline research. The second action was for WeRPN to offer an introductory course on research to provide the essential knowledge to use, engage, and conduct research projects. And that's what Ben was asked to develop that, and he did, and he's going to describe that shortly. The third action was to develop for 2022, 2 awards of excellence in research. One for an individual RPN who has contributed in a significant way and an ongoing basis to research in practical nursing in Ontario, and whose efforts have demonstrated evidence-informed nursing practices. And then one for an organization that has contributed, again, in a significant way and ongoing basis to creating, utilizing, and/or participating in research in practical nursing in Ontario, and whose efforts have optimized and are advanced evidence-informed nursing practice for RPNs. These awards of excellence in research have nominations that will open in May of 2022, so keep that date in mind when thinking who you would nominate. The fourth action, we will conduct a literature review of RPN evidence, peer-reviewed, formally published, and gray literature included. The last literature review that WeRPN conducted was in 2014, and we also contributed to a literature review on RPNs in home care conducted by Dr. Rebecca Ganana McMaster in 2019. We know the literature is not robust, but this literature review will give us a current understanding of the available RPN-specific research and whether our efforts are working to increase the number of studies in the literature and whether the contents meet the information needs of government, policymakers, industry leaders, and the nursing community. The fifth action was to establish a research advisory council as the governance model for the research strategic plan. The council will guide the process for identifying important research topic ideas or refine the key priorities that I described earlier. And they'll do that by capturing membership opinions about essential research topics. The council will establish a researcher network to support the identification of collaborative opportunities. We are a small organization, so we need to reach out on many occasions to collaborate for key skills such as methodology and data analytics. The council will be responsible to initiate WeRPN calls for academic research proposals, calls for RPN research fellowship proposals. The council will receive external participant recruitment requests and research partnership requests. They'll evaluate the nominations for the Excellence in Research Awards, and they'll also evaluate and recommend approval of any of the research grants and fellowship grant applications that are in those calls. The council will also monitor research expenditures and investments and conduct an evaluation of the overall research strategic plan. And lastly, they'll ensure that there's a succession plan for membership. The council will identify and recommend new Research Advisory Council members as necessary. There's currently 12 members on that Research Advisory Council. It's chaired by Annette Weers, the Director of Professional Practice and Research at WeRPN. There's 3 additional WeRPN executive leaders, 1 professional practice associate, 2 family members who happen to be former nursing school faculty, 2 WeRPN members at large, 2 academic members, 1 from a college level program and 1 from a university level program in nursing, and 1 board member, currently Deborah Cowie. The Research Advisory Council had its inaugural meeting on July 27th, and they recommended 4 RPN-specific academic research projects. In addition, they recommended a modification in the call for RPN research fellowships process for this fiscal year, as our initial call didn't yield any applications. The revised process, though, yielded the recommendation of 2 fellowships valued at $12,500 each, and they were just awarded last week. This actions to support the second objective, to sponsor, support, co-produce, or create priority area research projects, reflects what's happening in the population current needs and trends, and it aligns with the WeRPN research priorities, as I discussed earlier, and emphasizes RPN-specific knowledge, skills, interventions, and tactics. This objective is rather dynamic, and opportunities arise and evolve as more information is presented. And the outputs can be categorized into both externally initiated projects and internally generated projects. So the external projects can be several types. One, partnered or co-produced externally funded peer-reviewed projects. And we're currently engaged with 2 of these. One where WeRPN has partnered with Western University and Lambton College on a 1-year $25,000 Social Sciences and Humanities Research Council of Canada grant. Say that 3 times. It's titled COVID-19 and Resiliency: How Registered Practical Nurses Working in Long-Term Care Adapt in Times of Personal, Professional, and Institutional Crisis. And that's the one that Jen sits on. And it was slated to finish on November 30th, 2021, but we have an additional MyTax grant of $15,000 and a knowledge mobilization grant from Western valued at $7,000, which allows us to continue until April 2022. And with that, we're going to initiate new WeRPN self-care and leadership education programs, as well as work on an organizational resilience guidebook for long-term care homes. And then we'll also be doing more manuscripts and more presentations with the results of the quantitative and qualitative results. We present to the WeRPN board on January 20th about this project. Our investigators are Dr. Denise Conley, Dr. Anna Garnett from Western, Dr. Tracy Smith-Carrier from Royal Roads University in British Columbia, Diane Pearson from Lambton College, 3 WeRPN members, Jen Calver, Samantha Salatino, and Sandra Osborne, and then collaborators such as Dr. Smear Sinha. The second externally funded study is again with Western. It's a national implementation science team grant under the Strengthening Pandemic Preparedness in Long-Term Care project. We're partnered with 2 long-term care homes in Southern Ontario as they implement an intervention that addresses 3 promising practices. One is improving the psychological health of the workforce. The second promising practice is increasing family presence, and preparing for this and future pandemic outbreaks is the third promising practice. So what we're piloting is a revised virtual pieces intervention for virtual team-based care planning with virtual family engagement. This study was funded for $150,000 through the Canadian Institute for Healthcare Research, administered by Healthcare Excellence Canada, which was formerly the Canadian Patient Safety Institute and the Canadian Foundation of Healthcare Research. This grant runs from March 2021 to March 2023, and our investigators are Dr. Denise Conley from Western, Dr. Lillian Hung from University of British Columbia, Dr. Anna Garnett from Western, and 2 mentors from Pieces Canada, with other collaborators such as Dr. Laurie Schindel-Martin and the SPORE colleagues supporting patient-oriented research. The second kind of external projects are supported external recruitment assistance projects. WeRPN plays a key role in supporting external research studies for participant recruitment. You will have seen several requests over the past year in your social media and in newsletters asking for participation. Requests have been received from the University of Calgary, the University of Toronto, Ryerson, McMaster, Western, and Ontario Tech University, etc. We assist them through advertising in things like the Pulse newsletter or the weekly COVID newsletter, on social media channels such as Instagram, Twitter, Facebook, LinkedIn, all of those. And over the past year, we've had 10 requests for this type of assistance, where you would have received survey links or opportunities to engage in interviews. Many of you have taken them up on these requests, and we thank you for that. We hope you continue it. And this is how, because this is how RPN's voices are heard and get represented in the literature. So please keep participating in those requests for research. The third type of external project is sponsored call for academic research proposals. And I've mentioned this a little bit before. We're very proud of this initiative. We launched our first call in May of 2021. 5 proposals were received and 4 are now under agreement for completion in August 2022. The first project is in the community care sector. It's called Building a Sustainable Supply of Home Care RPNs using an employer-based educational assistance program. The principal investigator is Dr. Lady Bolangata. The second project is in the long-term care sector, exploring the role of the registered practical nurse in long-term care homes. There are co-principal investigators here, one Dr. Veronique Boskart from Conestoga, and also Sue Strutt, an RPN. Project 3 is in the rehabilitative care sector, building capacity in rehabilitation services, mapping rehabilitation nursing care practices in geriatric and stroke rehabilitation units. The principal investigator is Dr. Denise Conley. And the fourth project is in the acute care sector. So we had one in almost all sectors. It's titled Barriers and Facilitators to the Practice of RPN Role in Academic Acute Care Hospitals. And the principal investigator is Sonia Kanzian from Unity Health. These latter 2 research projects were also awarded RPN fellowships just recently. And then the fourth type of external project is where we create and submit projects. Some have been declined and some are pending notification. 3 grant applications have been declined. One we worked on with Ryerson, one we worked on with Parkwood, and one we worked on for the Drummond Foundation. And then there are 3 pending notifications, 2 from the Canadian Institute for Health Research and 1 with Heart and Stroke Foundation of Canada. So then the second part of how do you sponsor, support, co-create is around sponsoring internal projects. And some of these studies are conducted by interns where the study or quality improvement project is not funded, yet provide valuable information to the WeRPN leadership. For example, one project was on what was the workplace of choice for new practical nursing graduates. And 2 are currently underway. One is evaluating the utilization of WeRPN self-care modules, and one on the practical nursing student perspectives on caring for the older adults in long-term care. Additionally, we have internally funded an interventional study with Closing the Gap, led by Norma Tomlin, the WeRPN professional practice manager. And it's being evaluated by the University of Toronto. This project kicked off May 31st, 2021. It's still underway. And there are 2 interventions. One relates to the Institute for Healthcare Improvement framework, Joy and Work framework, where managers are focusing on creating interventions that improve joy and work for RPNs. And the second one is an intervention for RPNs created by Donna Wheeler for WeRPN about health coaching and system navigation supported by the WeRPN professional practice coaches. So there's lots of research activities related to RPNs right in the forefront. In summary then, the aim of the WeRPN's research strategic plan is to delineate phases of research activity to improve representation of RPNs in the literature. So we are going to gather, access, create, and sponsor research evidence to advocate for WeRPN members regarding impact and value of RPNs. Our vision is by 2024, we will bring together knowledge users, researchers, academics, employers, elected officials, government decision makers, and provide evidence-informed knowledge-skilled professionals and collaborative partners to create research excellence in the RPN profession. No small task. Our key priorities, should you be asked in an elevator what your research priorities are, RPNs are gems. The impact and value of the role for the RPN requires extensive study. RPNs care. We need to look at the delivery of care models. RPNs are leaders of change, and excellence in practice and leading change is some of their key work. And then RPNs are links. We are a crucial link in the health human resource chain. So we'll know what success looks like when we look at the results of those two strategies: sponsoring and supporting priority research projects and creating inquisitive research knowledge culture. And the newly established Research Advisory Council will be accountable for evaluating and reporting on the outputs of this plan. And so now I'd like to pass it over to Ben Hartung, who will describe one of the tactics to creating a research knowledge culture.
Thank you, Nancy. It's so exciting to hear all the different aspects of nursing research that WeRPN was engaged in. And thank you, Sharon, for that warm introduction. So I'm Ben Hartung, very excited to be here with you guys this evening. I'm going to give you an overview of a new course that's coming out in winter, this coming, I guess, next year. It's called Demystifying Research, an introductory course on nursing research. So we really chose Demystifying Research as the title because we know many people are interested in research and curious, like everyone here tonight. It was great to see that poll, but sometimes it's hard to really wrap your head around, the different aspects or how to get involved. So we really tried to break down the different aspects of research to really focus on, what's applicable and practical in your practice, and how you can really use research to improve the health outcomes of whatever population you're serving. So the purpose of the introductory course is to prepare RPNs to participate and lead nursing research at a local level. Who should take this course? Any RPN who is curious about nursing research, there's a clinical problem that they want to solve, whether it's something that's come up recently or something you see over and over again. This would be a great course to really try to figure out what you can do to help solve that problem in your setting. And then anyone who wants to be involved in nursing research, whether you want to participate or lead, this course would help you to meet those objectives. The course will be asynchronous learning and it will have a WeRPN facilitator. So similar to your the other courses offered by WeRPN, there's an interactive platform that has weekly readings that are required, but also optional readings. This course is designed to let you go as deep into the content that you want to. So there's always extra readings and extra activities that you can engage in to get the most out of what you want for your particular interest. There'll be discussion posts and comments, so you'll be able to interact with other learners, learning activities, knowledge checks, videos, and links to external resources. So next, I will go through a summary of the different aspects of each week. So on the next slide, thank you. We're starting out with the fundamentals of research. So week one really looks at what is research, what is quality improvement, how is it different, how does research affect me and my practice? And then we really focused on developing a research question. So again, going back to that clinical problem that's coming up all the time, or something that you really wanted to look at but didn't quite know how to, we developed this, a research question in week one that we will build on throughout the remaining 8 weeks. Doesn't mean that if you're sick of your research question by week 2, or you maybe didn't think it was the right one, you can easily change it. But we like to build upon that knowledge throughout. In week 2, we talk about theory and research frameworks. And usually when we talk about or hear about theory and frameworks, our eyes, start to gloss over, and we get that nice serotonin release when we start to, feel sleepy. So we've really worked hard to try to make this applicable and interesting to really help you understand theory in a way that it can help you answer that research question and help you answer that clinical problem you're experiencing in your practice. Week 3 looks at critical appraisal. So talking about what evidence is already available to help you answer your research question. So we look at the different types of peer-reviewed published articles, which ones are more reliable, how to read and interpret these articles to determine if your research question has already been answered, or if you have found an area of research that actually needs to be looked at and addressed. And then we spend week 4 on finding research. So accessing peer-reviewed literature can be tricky sometimes. So we really dive into that. And it doesn't matter if your organization has a library. You don't necessarily need that. So we talk about all the different tips and tricks you can do for accessing literature and determining if that literature is valid and reliable. And we also kind of do a refresher on how to reference, because as you move through the course, at the end it's writing a report, and you want to make sure you're able to have all your references available for you. In week 5 and week 6, we dive into knowledge translation. And knowledge translation is about understanding how you can move evidence into practice and how you can use evidence that you've found through peer-reviewed literature, and how you can use that to maybe do a quality improvement study, or maybe you need to address your research question by actually conducting a research study. So we talk about the different methods you can move that forward. We talk about your stakeholders, how to engage your stakeholders to really set yourself up for success for doing the next phase of your project. Which brings us to week 7, where we talk about the components of a research project. So it's kind of a roadmap of how to set up a research project, whether it's peer research or quality improvement, that will help you address your research questions. We go through ethics, we go through the different methods you can use, we go through sampling, all those different aspects of your research project. Then we also talk about the components of a research report. So how you write up your report after you're done your project. And then in week 8, we talk about creating evidence. So I find this is the most exciting part, because after you're done your research project or your quality improvement project, you're now the expert on an area of nursing, and that expertise should be shared. So we talk about how you can present it at a conference or at a staff meeting, or writing up something for your local journal or even a peer-reviewed journal. So that's covered in week 8. And throughout the whole course, we are really trying to develop that foundational knowledge for you to really be leaders in nursing research. And whether you go on to do your research project or to participate in research, this course will help you have those foundational principles. In addition to this course, WeRPN is also going to be hosting some research seminars in the new year as well, closer to the spring. They're going to be on aspects of this course, but it's going to dive in a bit deeper with others. So the purpose of it is going to be an interactive webinar where we're really talking about the challenges you're experiencing, how to really develop that research question. But it's going to be really focused on building on each other's strengths, learning about how your other colleagues across the province are engaging in research, and then using that to go back to your organization to really try to move research forward and help to mobilize it to address your research questions and help improve the outcomes of your population that you're serving. So I hope you are excited about the course. It will be available to sign up on the WeRPN website in the new year. And now I'm going to turn it over to Jen, who's going to give us her story about being involved in research.
Thank you, Ben. I have to echo what you said there. This is very exciting, what Nancy and Sharon you spoke about today. So again, I'm very happy to be here to share my story. Thinking about research, if you had have asked me 4 or 5 years ago if I was going to engage in this field of research as an RPN, I probably would have looked at you with a blank expression on my face and shrugged my shoulders, really being naive to this world of research. I knew that nursing is an evidence-based practice. I knew that we drew from the sciences and past experiences and stories to continuously advance the nursing profession. But when it came to research, I don't know why, I never put them together. And for myself, I wanted to continue to build upon my professional practice as an RPN. And there was times where I felt like I was hitting these barriers or roadblocks to pursuing areas of specialization or advanced nursing practice. And if as a profession, RPNs have done some wonderful work demonstrating that incredible value they bring to the health team. But we still have some more work to do. And one of the ways that we can do this is through engaging in research. Now, this is how we advance patient care. So all this is to say that RPNs do belong at the table. RPNs do have a tremendous influence on professional nursing practice. And so this is looking at current practice realities, but also our future of nursing, right? RPNs work, we mentioned earlier, Nancy, you mentioned earlier, across a variety of settings and with that, each role lends to a little bit of differences in the responsibilities the nurses carry out depending on where they're working. Yet that goal of the profession, it really remains consistent, right? We're up there, we're advocating for people, and we're providing that evidence-based nursing care to support optimal outcomes for individuals. And when we think of research, it's not typically assigned to the RPN role. It's not something that comes up as we're providing that direct patient care in the day-to-day work of a nurse. So it's not a conversation that generally just flows naturally. Yet research plays such a vital role to the professional nursing practice. Now, I'm looking at you today, and I'm saying this with confidence and conviction. RPNs, yes, they belong in research, but it took me a little bit to get there. I've had moments where, well, I guess I've experienced rejection. I've been excluded from opportunities, and I think, oh my gosh, maybe I'm not a good fit. What is it, because I'm an RPN or what's going on here? And I've allowed opportunities to slip away. I've felt almost the elements of pressure because I thought I was kind of veering from that linear or what some people think is a traditional pathway for nurses. And it was kind of eye-opening for me because as I was sharing some of my own feelings and experiences or thoughts with my nursing colleagues, they were kind of sharing some of these experiences back with me. And that was quite eye-opening because then I started realizing that for every wall I'd hit, for every single person telling me that as an RPN, I cannot do this, there were so many other people in my corner cheering me on. And that's what it took. I had to kind of look and shift my own mindset and stop focusing on what I couldn't do and start looking at these possibilities. So when I did this, when I changed my own mindset, I began to see more clearly that RPNs are very much a part of the future. RPNs are change leaders, right? We show up every day, we work together to make that difference in the lives of others. RPNs do bring that valuable insight to the table. So with this mindset shift, it helped me to really discover some amazing opportunities that are open to members of our profession. So one thing I'll have to say, and I mean, hearing everything that has been said here this evening, WeRPN is doing an excellent job as a professional association, bringing RPNs together as a discipline and letting other people know what RPNs stand for. So this new research strategy that has been shared here with you today and these educational opportunities really does help set that path for RPNs to influence, the best care for patients. It looks at health system improvements. It strengthens the role of RPNs across the health continuum. And I'm not sure, but I can imagine some of you here strengthening the role of RPNs and you kind of grimace a little bit because you're like, oh, RPNs, they can't work any harder than they're already working. And I hear you, RPNs are working to the bone. But when I'm talking about strengthening that role of nursing, when I'm talking about strengthening the role of RPNs, I'm not referring to more work. It's rather taking those opportunities and actions to help others understand that value RPNs bring to those health teams, help establish role clarity, and reduce some of that ambiguity in the workplace. So I'm very pleased to have this opportunity to speak with you here today as an RPN with my research hat on, knowing that I'm still very new to this world. I've only been kind of looking at it for maybe 2 or 3 years, and I still have a lot more to learn. But I'm very pleased to be here to share with you how research has helped shape my practice over time and how it has advanced some of my professional development. So I guess for me, I started looking more at research when I returned to school to pursue my Bachelor of Allied Health Sciences. And this was at Ontario Tech University in Oshawa. And what this program was a cross-disciplinary research intensive pathway program for healthcare professionals. So I got to learn alongside other nurses, as well as other members of the health team around health system issues and so much more. Some components or pieces of the program was really designed to help students understand research. So actually, Ben, you touched on a lot of it in the course here today, which is wonderful. But it really, for me, is when I started looking at the different research methods, when study designs, considering ethics and that knowledge translation. And these courses really helped us to kind of dive in to what research was. And I thought it was really interesting because, again, nursing is an evidence-based practice. At the end of my second year of the program, there was an opportunity posted for students to apply for the student training research assistantship. So this was a full-time position for the summer to work with an established researcher. And it really struck my interest because I knew through my coursework, I was really only starting to scratch the surface to have my understanding of research. And this was a great opportunity to dive in a little bit deeper into this world to see what it was really about. A challenge for me at the time was I was working full-time as a nurse. I was enrolled full-time as an undergraduate student and raising my family. I had been working for several years in a unionized environment for an employer who I highly respected and with some amazing and wonderful colleagues. So with this position, I had to consider if I was accepted for this research position, what the implications would be for my family and for my work life. Looking again at our present situation as well as our future. And it wasn't easy. It was quite a tricky kind of thing to navigate for me. But I took the leap, I applied, and I thought, I'll figure it out. So I went to my employer and I had a few meetings with them to see what this might look like if I was a successful candidate. I engaged my family in discussions and some of my friends. To be honest, I engaged anybody who was willing to hear me out and to provide input and insight into what this might look like and how this might become possible. And I love that about nursing. Nurses are there to support other nurses, right? That mentorship piece of our profession, I am so grateful for it. I wouldn't be here doing any of this today if it wasn't for my fellow nursing colleagues and the other members of the health team that have helped me along my journey. When I received word that I was accepted for this research position, when I was awarded that opportunity, I still was very uncertain how I could fit into this research world. And this project was titled Extending the Duluth Model to Workplace Bullying. So a very new field for me. But you know what? I ended up accepting it. And with the support of my employer, I went to a casual position. And I just figured, it must be meant to be, everything will work out. And I was right, thankfully. So for me, it did work out. And I did get a wonderful experience working with this researcher at Ontario Tech University. It was absolutely amazing, but was really interesting for me as well, in addition to the research experience, is that I felt that my contributions as an RPN to the project were really incredibly valued. And that's something I hadn't really considered previously. I always saw research and nursing were separate. So by the end of that assistantship, I was able to reflect back, and I was really satisfied with the choice I'd made to pursue that avenue. And then it brought me to apply for another opportunity at the university to engage in a research practicum. So the final year of my program, I would be, when accepted to this program, that I would be paired up with another established researcher. And what was really interesting about this when I got into this opportunity is that I was paired with a health services researcher with expertise in policy. And it was wonderful and amazing because his work was so much different than the previous researcher I had worked with. It was new research methods, new ways to look at the data, and it was quite wonderful. So my research practicum project was looking at the incidence of hospital-related injuries in children and adolescents with intellectual and developmental disabilities. So it was a cross-sectional study of injury rates, looking at administrative health data. And again, my nursing hat, that documentation that feels so burdensome sometimes when you're trying to provide that patient care, it really opened my eyes to how important that documentation is to inform the future of nursing. And to inform, patient care. So during this time, I also learned about the peer review publication process. I am very grateful to have had the opportunity to work with Dr. Ballo and Dr. Rodoler at the university and publish the study. I learned more about academia and how I can continue immersing in research as an RPN. So it really helped me to develop a greater understanding for how research engages people, how it informs practice, inspires innovation, and really does set that path for moving forward. Throughout my professional journey, I've recognized that to achieve that high quality and best care for individuals, we need to gain a better understanding of the experiences at the front line of practice. So this is to better understand those personal, those social, emotional, and practice realities. And this is where I feel that RPNs have a wonderful opportunity to contribute. So from my own thesis work in the area of nursing and policy to projects on COVID-19 and healthcare providers, I've continued to immerse myself in this research world. The opportunity Nancy and Sharon had spoke about earlier is I do sit on that study to explore how registered practical nurses working in long-term care adapt in times of personal, professional, institutional crisis, looking at COVID-19 and resiliency. My role as an RPN on that team is to contribute to the project as an RPN to help inform the study, make sense of the data, and bring that RPN lens. And the RPNs who have participated in that study and that those shared experiences and viewpoints of RPNs will support the development of practice resources. It's looking at generating recommendations for practice guidelines, informing institutional and governmental action plans, and it's even looking at influencing policy change. So I know my research journey is just beginning. And nursing is that profession where we draw from our foundational knowledge base to continue to build it up over the course of our careers, even well into our retirement years. I'm sure some of you here have cared for those retired nurses who always tell you that once a nurse, always a nurse. So this just says to us, parts of our journey in nursing, it may be predictable in the sense that we show up each and every day to help care and support individuals and their loved ones. But other parts of our journey, begins to take shape over time. And it's through these shared experiences of others. It's through sciences and their stories. So my experience in the research world has provided me the opportunity to see how important RPN engagement is and that value RPNs bring to advocate for health system improvements and those health outcomes. I think I'm a little bit over my time now. Sorry, I get kind of carried away talking about RPN and research. I do wish you all the best along your nursing journey. And if you ever have any questions, please don't hesitate to reach out. So maybe I'll take this time and turn it back to Nancy, or I'll just keep going all evening.
Thanks, Jen. That story is really inspiring. Listening to the struggles, but also the successes that keep you going. So I'd like to kind of wrap it up by saying thank you for taking the time to learn about WeRPN's research strategy and where we are at with the current implementation of the strategic plan. We're hoping you will consider enrollment in Demystifying Research, the Introduction to Nursing Research course. It could be your first or your next professional development step in becoming knowledgeable about using evidence or creating and leading a research project. And more importantly, we hope hearing about Jen's experience about incorporating research into her professional life has really inspired you too to just dive in. Our next steps are in this implementation plan is to launch the introductory course in January. We will be doing the call for nominations for the Awards of Excellence in Research. So there'll be two, one for RPNs, individual RPNs, or one for an organization, as I said in May. We're going to be launching a research quarterly webinar, our first one beginning February 8th, 7 to 8 p.m., where you'll hear Dr. Elizabeth Peter, a professor at the Bloomberg School of Nursing at the University of Toronto, and she's going to be live discussing the findings from her study with RPNs on strategies to combat moral distress created by the pandemic. And she talks about a concept of moral habitability in your workplace, so it's fascinating. We'll also be continuing to pursue our funded partnership opportunities for peer-reviewed research. We have a grant application going in on December the 15th to the Social Sciences and Humanities Research Council again. And we're waiting patiently for those pending notifications from Heart and Stroke Foundation of Canada and the Canadian Institute for Health Research. We'll also be monitoring and reporting on the current projects that we are funding in partnership and through the in-house interns, the academic research projects, and the fellowship projects. So we'll have much more information to let you know how we're progressing, probably kind of like in the next 6 months or so. So I'm going to pass it back to Sharon now to wrap us up.
Awesome. Thank you so much. Thanks to all of you. Thanks to the panelists. Thanks to everybody that's, for the record, doesn't look like anybody has left us. So an engaging webinar this evening, which was great. We do have some time for a couple of questions, and I will start with Karen had put something into the actual Q&A, which was, will there be any research in the primary care settings? Which maybe Nancy, can you field that?
I sure can. Thanks for the question, Karen. Primary care certainly would be an interesting sector of the health system. We didn't receive any in the first call, but maybe in the next call. We didn't exclude primary care by any means. It was just that we didn't receive one. So get your thinking cap on and find some research partners and consider crafting a project. And we may get into primary care in the next call.
Awesome. Yeah, that's how to make it happen, isn't it? To just, let's just do it. How about, Ben, a question that's come up. We've had some sent in separately, which is, I've never been involved in nursing research or quality improvement before. Can I still take this online research course?
Yeah, that's a great question. So absolutely, this is meant for any level of previous involvement in research, but it's really there to help those that have no experience or remember very little from school. So it's for sure an entry level where you'll get a good foundation, a lot of practical examples throughout. We tried to demystify it, so really take out the confusion to really make it applicable to practice. So absolutely.
Awesome. That makes it sound less intimidating. Okay. How about one that had come up that would probably go to Jen? Am I able to participate in research anonymously?
That's a good question, Sharon. Anonymously. So, I kind of remember feeling a little apprehensive to answer some of those call for research, some of those studies where you're filling out their survey. So there's definitely opportunity there where you don't have to disclose any personal information. I know ethics considerations that the project investigators go to great lengths to make sure that any participants' confidentiality and privacy are respected. So in that sense, and I mean, you can always share and lend your voice.
Awesome. It seems like we're just breaking down barriers as we go. How about this one can go to Nancy. Will there be RPN Research Fellowship opportunities next year?
That comes to the Research Advisory Council to make that decision. And if we do, we would be recommending kind of like, I guess, a dollar amount to the WeRPN executive leaders for funding. And then if they approve it in the budget, then it goes forward as a call for academic research proposals, probably beginning around April of 2022, in order to get the proposals evaluated and notified for the start of a fiscal year, July 1, 2022 to June 30th, 2023. So we've had some pretty good success this year with our studies. Our midterm reports will come in around March the 1st. So we'll have a better understanding of whether the projects were doable and people are enjoying them. And that'll help us make some decisions as well. So, but I'm hoping that they're going to go for a second call. And I've had lots of feedback from the leaders that suggest that they're really pleased with how it's going. So I think so.
Awesome. Wonderful. This one I can direct to Ben. I work at a small organization and we don't conduct research. So would that course in particular still be for them?
Yeah, so great question. Sometimes smaller organizations don't seem to have the same involvement in research. So absolutely, this would be a great opportunity for you to be the leader in your organization. So learning those fundamental principles, but also in our knowledge translation section, I think it's week 5 and 6, we really talked about how to, sell your project and sell your idea to your manager and how to communicate to them and how to get them on board. And what do you do if your organization doesn't have a research ethics board, or how can you obtain research ethics by reaching out to other organizations? So for sure, the course is meant for those that are in small organizations as well as large.
So everyone, all RPNs, exactly. Okay, we'll squeak in another one. We're kind of just trickling over. So maybe last. Jen, how can RPNs who have limited time available, perfect for you, be of support to nursing and health research initiatives?
Oh, time. Something that we can all use more of.
Right.
Do you know what? So I guess it just depends on the project. So again, answering some of those calls, I in my experience, the researchers, or to share your voice in some of these areas, are very conscientious of people's times. And so all you have to say is, what, I'm really tight here, but I want to share, and they'll be more than happy, if they can, to work with you. And I mean, there are opportunities to jump in and have your say, where you're not spending hours and hours and hours and weeks and weeks and weeks. There are different lengths and duration of projects.
Awesome. So, I mean, there's at least options there, even if you don't have, full-time available. So, Okay. We've had a quick one come in from Queenie. I have a postgraduate diploma in clinical research. I just don't know how to pursue it as an RPN. Maybe Nancy, can I lob that to you, or?
Yeah, and I think all of us can answer it in some perspective. From my perspective, great. Great that you have a postgrad diploma in clinical research, because we're always looking for RPNs to participate at research tables. We've actually called on Jan quite a bit, and it's really great to know that we could call on somebody else. So when we're devising these research projects, when WeRPN's involved, we are always going to try and have an RPN presenting at the table the nursing culture, the nursing lens, because I'm not a nurse, and frontline perspective gives us a deeper understanding of whether we're investigating the right thing and whether we found something that's relevant. So just knowing that you're interested is one way we're going to probably get you involved. Another way may be that if you can find one of your workplace, I guess it would be at a next level, so supervisor or manager, and really start to try and see whether your institution or your organization is interesting in pursuing research, because it doesn't have to be major projects. It can be small quality improvement projects. And I think this is probably where Ben can really add to this idea of how do you take a small idea or what feels like a small idea and launch it into something that's going to change practice for more people. So Ben, I don't know whether you can comment on how you take it from, how do you take it from a small idea into something larger?
Yeah, no, that's a great question. And, I think what you're saying, Nancy, letting your supervisor, your manager know that, you're interested and you have the skill set that, will be of value to the team. I think all organizations now have quality improvement projects they're working on. And, the more that we have RPMs and just, the staff involved, the better. And there are so many small leadership roles you can probably take if your leaders and your managers know that. They'd be probably more than happy to engage with you. So I think maybe the first step would just be reaching out to someone at your organization who you trust and who will be able to, maybe open that door and give you advice about how you can, take the first step in sharing your knowledge and your expertise that you have and bringing that to the table.
Wonderful. I think that's so much of this is it's not, myself, when I think of research, it feels like this great big picture, but it's a lot of very small pictures that you can get involved in, isn't it? Small change. So it doesn't have to be that big project necessarily.
It is about reaching out to others. It's about, you don't have to do this yourself. And in fact, you should be, this is really when you turn on the collaboration and your networking, because you can, reach out to somebody at a college or university level and present your idea, because they may help you take it further. They're looking for topics lots of times too. So if you can make those personal connections with some people at an academic level, that could launch you as well into seeing your idea go forward.
Can I add to that too? Because it's sharing your idea is great as well. And there's definitely a lot of interest there. I've also experienced where I've been really interested in somebody else's work and kind of how they're exploring it. So I've reached out to them. And so some of the research projects I've been a part of, it has been because I've reached out to them and said, you know what, I have this experience to bring. And I think what you're doing is absolutely fascinating. I'd love to a piece of this, or I'd love a chance to join your team if you ever need any help. So the connection piece, I think everybody spoke of, is very important.
Wonderful. I think you guys are lighting sparks as you're talking, so that's great. I think we'll call that. Thanks for your participation this evening. To all of our panelists, thank you again for taking the time. To our nurses that have been watching, we know how valuable your time is, so we appreciate that you've given us an hour of your evening. Our next WeLearn webinar will be January 12th, covering the topic, what nurses need to know about transgender health. So watch our social media and website for the registration coming up. So this concludes this evening's webinar. I'd like to thank you all for attending. I have put my email address up on the screen. If there's further questions or you wanted to contact maybe one of our panelists, I will pass that information along. By all means, I know they're all available for further questions if needed. So I would like to thank you for attending. I will sign off and remind you all to prioritize your self-care and to be safe. So have a good evening. Thank you. Bye all. I'm going to leave it for just a minute. Well, usually our little thank yous pop up on the screen, so we'll give it an extra minute. So, yay. I like when somebody says thank you and there are exclamation marks after their comment. So that's wonderful. Okay, and we'll shut it down. Thank you. Good night.